Welcome back. Before the break, we looked at many of the medical issues and challenges that people on the front lines are facing. But also today, we got yet another reminder about just how devastating COVID-19 is for the economy. Last month, the economy lost 700,000 jobs, and future months promise to be a lot worse. Plus, in just the past 2 weeks, 10 million people have applied for unemployment benefits. Congress, it passed that $2 trillion plus stimulus bill, and now people are waiting for those checks, but tens of millions of Americans aren't eligible, and countless small businesses are going out of business as people stay home and the streets remain empty. I want to bring in our guest right now to discuss how Congress is responding and also how people in his district are dealing with our new reality. Congressman Sean Patrick Maloney, Democrat, he represents parts of New York's Hudson Valley. Congressman, a lot of logistical questions people have, but first, I know you've been dealing a lot with constituent concerns, people with a lot of questions, and I know you've lost some of the folks you represent through this tragedy. I saw there was a school board member and a teacher in your district for 40 years who's lost her life. There was another person who was a farmer in your area who's already died from the coronavirus, in some cases without even underlying conditions. Put a human face on what you're hearing from how this has touched so many people just in your district.
Well, remember, the primary hotspot in Westchester County is just south of the area I represent. So many people in my part of the world ride the train every day and go to work in New York City. That includes first responders, cops, firefighters, healthcare workers, a lot of whom live in Orange County. But even the people who never leave the Hudson Valley to go to the city have been profoundly affected by this. There's a young woman who goes to school with my daughter who's fighting COVID-19 right now. There are people up and down my district who are going into work even though the risks are there, whether they're a nurse or a doctor, really on the front lines of this thing, working 12-hour shifts, reaching an exhaustion point. Or whether they're the young woman or young man at the grocery store who is stocking the shelves and checking people out and encountering dozens and dozens of people a day, regardless of the risk, because that's their job. You know, we are going to get through this, but we have to keep faith with so many people who have done this heroic work. We have to take care of those who are out of work and who are struggling to pay the bills, and help is on the way. But we also should compensate better the people who are really doing the tough work of this epidemic.
In fact, we just sat down with EMS workers and leaders talking about just what they're doing, as we've heard from so many doctors and nurses on the show every night. To that end, what are you seeing even in your area hospitals? This morning, Governor Cuomo said the unbelievable shortages in a very fast approaching period of time in the city. They're going to start having the National Guard getting ventilators from hospitals throughout the state that haven't been impacted yet to this degree. What is the state of supplies north of the city where people say haven't been impacted as much? How acute is the concerns that pretty soon New York will be you?
That is my number one concern. And we are checking in almost daily with every hospital, every community health center, every independent physician network that is right now caring for those who are sick. And what they are telling us is that they have enough supplies currently, but they are terribly worried that their supplies will not hold up. We are seeing cases increase in the Hudson Valley by about 8% to up to 20% every day in the counties I represent: Orange, Putnam, Westchester, Dutchess County. That is an unsustainable rate of increase. So that is why it is so important that we continue to stay home, work remotely if you can, keep away from other people to the maximum extent possible so we can slow that rate of increase.
I'm frankly too tired to even get into the president and all of the back and forth. But in terms of the federal government and the president and how they view New York here specifically, I want to play what he said earlier this week when he was with Sean Hannity talking about what the needs are of New York versus his perceptions of it.
I have a feeling that a lot of the numbers that are being said in some areas are just bigger than they're going to be. I don't believe you need 40,000 or 30,000 ventilators. You know, you go into major hospitals sometimes, they'll have 2 ventilators, and now all of a sudden they're saying, can we order 30,000 ventilators?
Forgetting the president for a moment, if the federal response, and you've heard from governors across here, it seems those who show fealty to the president or those states that are of a different hue than another may get a different response. How concerned are you that the federal government's commitment to New York right now will stay as it has, as we'll see expanding needs across this country, but there already has been a war of words with the president, with Chuck Schumer, and basically, depending on the day, how we've used New York, the federal response or the lack of a coherent one as it impacts the Empire State?
Right. Look, the numbers are just the numbers. The numbers aren't what the president wants or doesn't want. He nor I nor you should substitute our own opinion or preference for what the data is showing. And you don't have to have an advanced degree in this to look at the slope of the line. I will tell you, in other areas, I'm proud that the Congress has acted to respond to the needs of small businesses, to people who are unemployed, to get direct payments in the hands of tens of millions of Americans. That will happen over the next few weeks. These benefits are sweeping and unprecedented. They will address the economic crisis, at least for the next few months. But the immediate crisis around the epidemic and the protective equipment for our healthcare workers and the ventilators for our acutely ill neighbors, that has to have a coordinated federal response. The president needs to put a single person in charge of acquisition and distribution of this equipment, so the states stop bidding it up, and so we get the maximum amount of resources where the real need is. That is true increasingly of healthcare workers, by the way. We need to dedicate military physicians and nurses to this need. We need to call up the reserves who have medical capability, and we need to recruit healthcare workers from around the country through an organized, centralized federal effort led from Washington, so we can surge personnel alongside equipment. That is the only way we are going to handle over the next week or 10 days the surge in New York.
And to that broad point, it struck me when we're talking about this, so much of the response from the White House has been talking about a specific state. It's as if there's 50 different responses to 50 problems, and then the blame will be shifted. Well, the governor should have done this or that. How much longer are we still going to be looking at this as a state's issue rather than one that's affecting every American?
Yeah, I don't understand that perspective. This is a common enemy. It is a common enemy whether you live in a big city or in a rural area. And the virus doesn't discriminate depending on what your politics are or who you voted for. This demands an overwhelming federal response that is equal to the unprecedented nature of this threat. We can do this, but time is running out, especially on places like New York.
Last question, and I know we can't make the perfect be the enemy of the good here. In any administration, FDR would have a problem in getting everything out to the people as quickly as everyone needs it and would like. That said, though, we're already hearing, Congressman, that the SBA is completely ill-equipped to be able to deal with the scope of what they're looking at. And moreover, the public hasn't been girded for just how long it might take to get some of the aid to so many of the constituencies you just talked about. Are you confident that it's designed at least to be able to handle the crush of demand for so many Americans who are now out of a paycheck and worrying about all the bills that are piling up? And if we're not ready, what do we need to do?
Well, let's be specific. 60 million Americans will receive direct payments within 2 weeks. That is because they are already enrolled in direct deposit for their tax refunds. If you're not enrolled in direct deposit, now's a good time to do that, because you can still be eligible for those electronic payments. In addition to that, starting in about a month, the Treasury Department will send 5 million checks every week to the remainder of those Americans who qualify. That's the maximum number they can send out. So that's 60 million in the next couple of weeks, and then 5 million a week thereafter. That's fast. Nothing can happen fast enough, but that will help. In addition to that, the Small Business Administration and these other federal agencies are going to be hit with a wave of applications. That's true. And so there is an enormous execution challenge, which is why it is so important that this be managed well from the White House. This is the time for strong presidential leadership. We are here with our hands outstretched to partner with the president. He needs to act aggressively, though, in a way that gets help out the door.
I think that being an understatement. Congressman Maloney, thank you as always. I appreciate the time.
My pleasure. Stay safe.
All right, when we come back, speaking of the president of the first family, Jared Kushner, now one of the people, it turns out, who's running point on coronavirus. What could possibly go wrong? If history's any guide, more than a little. After the break, we'll explain.